I researched on that when I heard that from Dr. Navarro at the university. When my patient takes ferrous sulfate, I tell him to stop. Ferrous sulfate will oxidize vitamin E. And if the vitamin is oxidized, there is unrepaired damage. You will have heart attack very soon, you will have brain damage, liver damage, kidney damage. So that's ferrous sulfate. So mineral iron is dangerous. So what I give liver. And liver contains organic iron. And I save the patient from oxidative damage. Example, the kidney tissue biopsy is sometimes required in cases when the cause of the kidney disease is unclear. Collected with a local anesthesia by introducing a needle to the skin into the kidney, usually done as an outpatient procedure. Okay, you can do this in your clinic. I remember when I was a chief of hospital, I do all things like this in my patient. I have no choice but to do what I can do. Usually, next slide, I will forget. Okay, standard treatment for kidney failure. So let's analyze how is it managed. This is the standard approach, right? Management is the reverse. A diet high in protein and low in carbo. And I will explain it to you. But my patients will improve. Okay. Medications to normalize levels of blood chemicals such as potassium. Okay. Drugs to control high blood pressure, you will usually block the renin-angiotensin mechanism, so you will use two kinds of drugs, ACE inhibitor and ARBs. Okay? Short-term dialysis for patients who develop. Dr. Kim, welcome. From Korea. North Korea or South? From South Korea. Short-term dialysis for patients who develop severe high blood pressure. Okay, that is what we call malignant. That's too dangerous. Severe fluid overload, congestive heart failure, necessary dialysis. Symptoms of altered brain function. Okay, that can lead to coma. Severe abnormalities in blood chemistry. That is acute renal failure. Chronic renal failure. People with chronic renal failure are monitored closely with frequent physical examinations, blood pressure checks, and blood testing. Treatment includes dietary restriction of protein. Okay, it needs to be avoided or even in adjusted doses. Among the over-the-counter medications, the following need to be avoided or used with caution. As I mentioned earlier, analgesics, aspirin, and so on, flips of phosphosodiademas, laxative and antacids containing magnesium and aluminum. Okay, aluminum is toxic for what? Among the over-the-counter medications, okay, ulcer medications, H2 receptor antagonist and proton pump inhibitor. Yung ginagamit ito sa bacterial ulcer, ito nasasabihin ko ito. Fair shares, 79.6, almost, let's say 80%. Second year, 66% survival. Fifth year, 24, 10 years, 10 na rin. 10, same, remember that, 10% only. Number of kidney transplant, okay, performed, 2008, 70,413. Annual mortality rates for transplant patients, 2008, okay, 31.3 per 1,000 patients. Patient survival following transplant is higher with the transplant. Okay, 90 deceased donor, yung mga nag-donate na patay na, and living donor, mukhang mas maganda yung living donor, right? Okay, survival, the 10th year is 62, and the other one is 76. This is my approach, cellular biochemical medicine, and this is the treatment approach. Regardless of the type of kidney failure, treatment is begun with measures to address the current status of the patient, using pharmacological agents as necessary. Medications to control high blood pressure. Usually, you have to use the ACE inhibitor, okay, and receptor blockers. Angiotensin receptor blockers. Diuretics for edema, if necessary. Short-term dialysis for those with symptoms of altered brain function or severe abnormalities in blood chemistry. Hormonal medications called erythropoietin to correct anemia. So what I did this is, in this condition I gave a lot of bone marrow and liver. Next. Concurrently, patients are tested with rapid cellular balancing, 1 teaspoon daily for the first week and every other day, thereafter adjusted by the attending physician. The rapid cellular balancing is I got this from the contributions, scientific contributions to German doctors, Otto Henry Barber, Hans Albert Krebs, and Wilhelm Henry Schiller. If you'd like to know the details, you can request for my rapid cellular balancing CD. By the way, after the lecture, you will deliver free CD. Composition of the RCD, it is composed of biochemical salts, coenzymes, enzyme cofactors, antioxidants. Function to correct chemical imbalance, to initiate kidney repair with stem cell enhancing capability. Without stem cell, nothing happens, no healing. With the stem cells, there will be healing. Formulation, every patient's a unique being and the RCD is formulated according to individual needs. Goal: to overcome problems in hemodialysis patients like vitamin C deficiency, erythropoietin resistance, and chronic inflammation. Certain antioxidants are incorporated into the formula. Okay? That is the current opinion. Lately, antioxidants, antioxidants are very helpful in managing kidney disease. To slow progression of kidney disease and delay the need for renal replacement therapy, regulation of acid-base balance is necessary. Okay? Review of medical March 2011. To increase the pH of the blood, make it slightly more basic, thereby reversing at least some of the muscle wasting observed in patients and also keeping calcium levels in check, which is a problem during advanced disease. That is from the National Kidney Foundation Guidelines 2000. To correct iron overload and blood levels of zinc, which begin to decrease vast loss of kidney function. So the problem in kidney is what? Iron overload. It will further destroy the kidney. Okay, next. Currently, go. To correct iron overload. Okay, that's very common because all kidney patients are given calcium. No. And correct blood levels of zinc which begin to decrease. The zinc decreases, so medyo alalay ng magkakaindition. Yeah, you're right. Zinc is needed, right? Iron overload, be careful. So instead of giving iron, silver will give liver. Next time. Concurrently, patients administered with modified high protein diet. High protein is 40% protein, high fat 40%, low carbohydrate 20%. So what do you mean by 40% protein? Example, the calorie requirement is 2,000 for sedentary people, right? Per day, 2,000. Okay. 40% of 2,000 is okay, 800. Okay. So that will fall to that 800. So divided by 4, that will fall by 111. Okay. So that's how we compute for that. The English traditional diet is composed mostly of a large quantity of protein and enormous fat, but they have practically none of the diseases we suffer, including obesity, coronary heart disease, and diabetes mellitus. Modified diet high in protein must consist of the following: liver, kung kaya nyo ng broth, kung hindi, lutuin nyo na. And I use only butter for cooking. Butter. Eggs, I will explain that tomorrow, why butter. Eggs, whey and other dairy products, meat of ruminants, mga baka, pambing, kalabautuka, fish with fins and scales, because bottom dwellers and those without fins and scales, they are loaded with mercury, arsenic, lead, cadmium, and they are too toxic to the kidney. A low protein, high calorie diet usually given to chronic kidney disease patients with uremia, okay, can cause so much breakdown of the body protein that more urea is formed than if a high protein diet is given. That's from the journal. So this is what happens. If you give a low protein diet and you are excreting albumin, where will you get the albumin now? You will get that from your muscle. So the results, you will consume your body, and the result is a higher urea. Okay? So the low protein diet is counterproductive. You can see more. Glutathione. Have you heard about glutathione? Sure, everybody knows. By the way, glutathione is not malathione. That's a different thing. Whey is rich in glutathione, as well as vitamin A. Eggs are also very rich in glutathione. Okay? And according to Dr. Jimmy Goodman, glutathione plays important roles in the prevention and treatment of renal failure. The anemia that often accompanies kidney failure and dialysis is so very important, and the cardiovascular complication of kidney disease. Glutathione modifying agents offer promising treatments for both short and long-term complications of kidney disease. Okay, that is kidney failure dialysis. Okay. Now, what are the effects of whey milk or whey protein in kidney disease? Okay. Blood pressure falls. Okay. Its effect is just like ACE inhibitor. Okay. That is from cardiovascular therapy. And HDL increases, so that's good. The job of HDL is to remove triglycerides and cholesterol away from the arteries to the liver and then to the bile. The ACE activity falls, angiotensin converting enzyme, fall in LDL oxidation. Okay, tomorrow we will discuss this LDL oxidation because there is now a current knowledge that is not LDL that is causing the heart attack. Okay, that's for tomorrow. Bago po ito, hindi pa natin ito. Okay. There was a time when 2 weeks ago, there was a meeting there in the Lupan that was attended by Nolan Lam, the chief cardiologist of the Sentinels, and the other one is from UST. They were both speakers. They recommended regarding this a very lengthy comment. And thank God, God said, thank you, Dr. Navarro, for your presentation. And the other one says, we learned something from it. Well, that's an exchange between two doctors because higher sharpens higher. I learned something also from their presentation. Okay? And the topic was heart attack prevention. Next slide. Whey proteins promotes bone growth, wound healing, improved cognitive function for those with Alzheimer, mood, yung mainit na ulo, mabagay. High lipid, bababa triglyceride, cholesterol lowering, antimicrobial, it can kill bacteria and virus, anti-hypertensive, glycomacropeptide, non-methionine protein source for PKU patients, okay, anti-inflammatory, immune regulatory, aging, so you become from senior citizen, you become junior citizen. Antioxidative, it prevents damage. You know, oxidative damage is like nuclear bomb in our body. Anti-cancer, protease inhibitors, muscle strength. So, kung gusto nyo medyo umila na ang leg naman ni Papio, kailangan nyo siguro ng weight. Diba? Sakas ng Papio. Promote bone growth. Okay? High. Remember protein? Whey protein is one of the highest biological values, almost 100%. And remains also highest biological value. And that scares many of those who handle. So, look at this. High in protein, branched chain amino acid, okay, present in whey, raw milk, egg, and red meat, okay. So don't be scared about red meat. Use that. You will not have a renal patient. Can benefit patients with chronic renal failure. Oftentimes, chronic renal failure patients have a decreased level of branched chain amino acid foods, especially whey, causing protein wasting and altered brain function. Did you notice that the patients? The skin are becoming darker, okay? And minsan affected na ang kanilang mood. Okay? In dialysis patients, increasing, I'm talking about dialysis, but this from the Journal of Nutrition 2006. In dialysis patients, increasing branched chain amino acid induces an improvement in appetite and nutritional status, thus able to retard the progression of renal failure. Remember, when there is a disease, you need high protein diet. Whether it's kidney, it's liver, it's anything. Without protein, you cannot do something about it. Without protein, you cannot repair. So, without protein, if just all carbohydrates, no repair. Okay. A number of researchers Okay. This Annals of Internal Medicine, March 2003. A number of researchers have proven that protein does not harm the kidneys. There, protein, kaya nga, bukas marami pa rin. At sa Thursday, when I talk about liver damage, mas maraming misconception. In fact, an impeccable study in 1995 from Germany, okay, Actum, demonstrated that kidney function actually improved with increased protein consumption. Bawal po ang baboy. All and the red meat from ruminants, mga baka, kambing, kalabaw. Chicken is okay, but if it is broiler, it is inflammatory. So I tell my patient to use meat. Okay. That's the latest. Diets low in protein or fat. So now they are moving towards high fat, high cholesterol diet for kidney patients. Look at this time. Diets, that's from the American Journal of Clinical Nutrition. Diets low in protein or fat show kidney damage to the extent that albumin and blood were temporarily lost in the urine. So without fat, you destroy the kidney. Without protein, the kidney is not destroyed. Shocking, right? Next slide. When diet is too low in proteins, blood albumin, which is critical in urine collection, so very important. If the blood albumin falls, you get edema. Because it, okay? Very important blood albumin, so that it retains the blood, the water in the blood. Okay. When diet is too low in proteins, blood albumin, which is critical in urine collection, drops abnormally low. Blood fluids and waste remains in the tissue, causing edema. Giving adequate diet extremely high in protein corrects the condition. You must increase the protein. Okay. LPDs do not have a dramatic effect on slowing the loss of GFR in diabetic patients with chronic low protein diets. Okay, low protein diets in diabetic patients with chronic disease. That means you put the patients on low protein diet, okay, it has no effect at all on their chronic disease. Okay, that's from the American Journal of Nutrition, September 2002. So there's now a change. So we have to move faster. Okay, the low protein diet (LPD) and the moderate protein diet did not lead to protein wasting, but LPD did not decrease the risk of death for dialysis therapy compared with MPD. So if you go on the low protein diet, the patient is helpless. Okay. High intake of protein increases urinary calcium excretion. However, that is about 2009, when red meat was used as a protein source, there was no effect on urinary calcium or fecal calcium. Calcium balance or intestinal absorption. Though that means if you use red meat, you are not losing calcium. So the one on red meat is over. Proteins given must be high, sufficient to reduce all albumin loss in feces and urine, and to rebuild tissues to meet the general body needs and fulfill the demands of stress. Patients able to take 150 to 200 grams. Today, the protein allocation of kidney patient is 50 grams and below. I give my patients 200 grams a day. What happens to them? You will know better. Some of my patients are very tough. Patients able to take 150 to 200 grams of protein daily recover much more rapidly, and kidney biopsies show greater healing. I told you, no healing without protein, than in others obtaining less protein. From the American Journal of Clinical Nutrition. Low protein diet, LPD, was not associated with a significant improvement of renal function in patients with either types 2 or 1, types 1 or 2 diabetic nephropathy. If you are a diabetic type 1, for children, the diabetes type 2 for those old more than half, and you're in low protein diet, it's useless. Your kidney will just be better. Okay? The claim that is from Journal of Clinical Nutrition, September 2008. The claim that excessive protein intake jeopardizes the health of individuals with pre-existing renal disease is questionable. It's questionable already. That is Nutrition and Metabolism Journal 2005. Now, high in protein, what do you get in protein? You get the powerful antioxidant. You know, glutathione is called what? Master antioxidant. What about carnosine? It's called universal antioxidant. Where do you get carnosine? You get that from red meat. That is alanine histidine. Without carnosine, your glutathione will weaken. Because the power of carnosine is beyond glutathione. Look at this. Carnosine in ruminant meat. So I told you, mga ruminant, mga baka, kambing, karo, diba? Hindi ko pwede yung baboy, no? You will know that tomorrow. Bakit bawal ang mga? Protects against the adverse effect of high glucose level of renal cells. Okay? What happens? When the blood sugar rises, look at this now. The sugar combines with protein in the kidney to form H, advanced glycosylated end products. And that H is a superpower oxidizing agent that glutathione cannot handle. That's it. When sugar rises, the sugar combines with protein. So the product is advanced glycosylated, the sugar, glycosylated end products. And that is a superpower oxidizing agent that glutathione cannot handle. Only red meat can do that. Only meat from ruminants can do that. Prevents diabetics from getting into the advanced stage of the disease, diabetic nephropathy. If you are diabetic, you don't like diabetic nephropathy, you have to increase your protein so that you have enough carnosine. Reduce protein and DNA damage caused by glycosylation. Okay, that is H. Okay. That is from Diabetic Journal 2005. Okay, Diabetic Journal 2005. So that is confirmed already. Okay. Toxic metals produced by various metabolic reactions in the body are bound by L-carnosine and eliminated before damage to tissues can occur. So, that is also L-carnosine has a chelating effect on toxic metals. So, modified high in fat, high in cholesterol diet must consist of the body, liver, ayun na raw, okay, eggs, raw milk. Yeah, raw milk very important, huh? And bulalo. By the way, in front of you is Dr. Bulalo. Because I'm the very first doctor to recommend bulalo. Okay. A low protein, high calorie diet usually given to chronic kidney patients with uremia can cause so much breakdown of body protein that more urea is formed than if a high protein diet is given. Okay. That's okay, next slide. Non-fat milk. Remember, babies are now given non-fat milk, right? Their formula milk is non-fat. They remove the cream. That's the cream, I will spend that tomorrow after the month's that, the power of the cream. So the result is disastrous. The gelatin formula, where they add only corn oil, canola, soybeans, are highly oxidizing, that will damage the baby, it will cause cancer. Non-fat milk in pediatric formula can lead to kidney damage in children. Researchers pointed out that non-fat milk are extremely dangerous, okay, infant nutrition program. Without fat, no linoleic acid is available, which is needed by every cell in the body, including brain cells. This lack leads to kidney disease, a high level of total fatty acid and cholesterol in the blood, skin lesions like eczema, and poor wound healing. So you see, maya-maya ang mga apo niyo, anak niyo, ay lagi nasa doktor, pediatrician, kasi ang gatas nila ng breast milk is the best for me. If you cannot afford breast milk, kung wala kayo, you better get raw milk. Tomorrow I discuss that with you after hospital. Next slide. Every variety of experimental animals, including insects, has serious kidney disease if kept on a factory diet. and without uric acid. So you remove the cream, you are a candidate for kidney failure. Researchers from Mount Sinai, that is a New York hospital, found that rats genetically predisposed to having type 1 or type 2 diabetes given a low-fat diet develop kidney failure. Can you see that? Low-fat diet, low cholesterol, low triglyceride. When given a high-fat diet, the kidney failure was reversed. That is 2011 work. Sa Mount Sinai. Ngayon na po ito. It's exactly the opposite. Tomorrow, you will see more opposite. Kaya siguro ang pangalan ko, Dr. Robin B. Navarro. Kulalo, in Tagalog, it's also baliktad. Okay. Oh, bone marrow. Everybody's scared about bone marrow. Bone marrow with the RCB will enhance your stem cell production. Okay? I'm not talking about stem cells, so I already started. Bone marrow contains nutrients that are able to exert therapeutic effect. Some of these are as follows: DHA and EPA, docosahexaenoic acid, eicosapentaenoic acid, hormones, testosterone, estrogen, progesterone, human growth hormone, erythropoietin, saturated fats, proteins, arginine, glutamate, aspartic, glycine, hydroxylase, and histidine, endothelial progenitor cells, serotonin, beta-lactase, alpha-glycine. So we discussed this. Okay. EPA and DHA retard the progression of renal disease, especially IgA, immune globulin A nephropathy. That is an autoimmune disease. And bone marrow is very helpful. Both EPA and DHA blocks the production of pro-inflammatory mediators and chemotoxic cytokines in proximal tubular epithelial cells. If the mediators are there in the epithelial cells, it will get inflamed and be destroyed. Okay. Reduces proteinuria and ameliorates renal injury in the practice. Glomerulosclerosis. Sclerosis is hardening, scarring of the tubules and other types of renal diseases. That is from Kidney International Journal. Erythropoietin, the hormone found in the kidney, is deficient in patients with kidney failure. Of course, they cannot produce the hormone. Thus, leaving bone marrow, which is rich in this hormone, is beneficial to patients with renal failure. Okay. Beneficial effects of, that's from Acta Medica, beneficial effects of L-arginine have been reported in several types of chronic kidney disease. Third, endothelial progenitor cell. Prevented the progression of chronic renal failure. How? By migrating to the site of damage and reducing inflammation. Reducing glomerulosclerosis and tubulointerstitial fibrosis. So it prevents scarring of the tubules, which will cause blockade. Improve renal function, decreasing pro-inflammatory cytokines and adhesion molecules. And that is from bulalo. Pag kayo kumain ng bulalo, ang sakit nyo ay maglalakong parang bula. Parang tayo. Calf's liver. The liver, world healthiest food, rich source of vitamin A. For cancer management, they need a lot of vitamin A, not only the 10,000, 40,000, 50,000 to suppress cancer. And you need there the aid of liver. C and B complex and phosphorus. High in copper, selenium, tryptophan, and zinc. High in cholesterol, but high in niacin and riboflavin, a cofactor in regenerating glutathione, most powerful antioxidant. Okay, supraphysiologic doses of B vitamins may be required to prevent hyperhomocystinemia in dialysis patients. Okay? Hyperhomocystinemia, okay? If you have that condition, your C-reactive protein will increase and you're prone to develop heart attack, stroke, blindness, loss of hearing, Alzheimer, okay, and many other conditions. And that can be prevented by the B vitamins. What are they? Vitamin B6, pyridoxine, vitamin B12, folic acid, and riboflavin. And you find that all in liver. That's why liver is superpower. The liver is the highest source of B vitamin, including B12. Okay? Well, I had to study the liver because I heard that first from Dr. William. So I began researching that. So I think that I became a member of ICAM, I learned something about the condition of the low blood selenium is present in renal failure patients on hemodialysis, and even greater and dramatic in patients on peritoneal dialysis. Folic acid, is the main. Remember, the ruminants, they eat a lot of vegetable, right? Folate is from leaves, folic acid, foliage. Folate is the main determinant of homocysteine level in end-stage renal disease. Giving folic acid food decreases homocysteine levels in patients with chronic renal failure with or without dialysis. Okay. That's the metabolism. Eggs. Itlog. I remember when high school pa ako, meron kaming poultry, we have a poultry. So, bago ko pumasok sa school, I go to the market, dala-dala ko yung mga itlog na product ko. So, ang tawag sa akin ng mga classmate ko, itlog. Until now, itlog pa rin. Eggs high in cholesterol, but also high in choline and selenium. Now, you will know about choline tomorrow afternoon. High in phosphorus, but also high in calcium and potassium. Rich source of vitamins A, D, E, and B complex, and also in folates. High in carotenoids, lutein, zeaxanthin, and lycopene. Don't you know that the egg yolk contains 400, more than 400 carotenoids? That's why it's yellow, right? Yes, right. Increased amounts of dietary lutein from green leafy vegetables and egg yolks could be protective against atherosclerosis by slowing the progression of atherosclerotic lesions in humans and animals. Egg white lysozyme can protect the body against bacteria and viral inflammatory diseases. The discoverer of penicillin is Fleming, remember that? Okay. Alexander the Great. We have your key Arthur, and we have Alexander Fleming. He noted that the wall of the bacteria can be destroyed by yeast. And he found out the penicillin, the yeast contains penicillin, right? And that's what the beginning of penicillin. Now, eggs contain that effect. Lysozyme eggs can kill bacteria in egg white, okay? Egg white lysozyme can protect the body against bacterial, viral, inflammatory diseases. But if you eat egg white raw, it has to be raw. If it is cooked, the power is gone, okay? Next. Cysteine. That is found in egg yolk, right? As a source of glutathione, is a powerful antioxidant. Look at this. Did you know about glutathione? The first source of glutathione is egg yolk. But if the egg yolk is overcooked, the cysteine becomes cystic acid. It's useless. You cannot avail of that. It won't convert anymore to glutathione. But even it's still raw, okay, a half-cooked lang kay ninyo, you still get the cysteine power, you produce a lot of glutathione. And what you do, it can deactivate hydrogen peroxide free radicals. These are the top 4 free radicals. Oxidizing agent. Hydroxyl free radical, singlet oxygen free radical, superoxide free radical. All of these oxidative stress are enhanced in renal patients. That is nephrology dialysis transplant year 2000. Right? So it is now used. Next slide. Cysteine in egg protects against scavenging of free radicals found in contrast diet that causes damage to kidney cells and may also have a dilation effect on blood vessels by increasing blood flow to the kidney. American Journal of Cardiology 2002. Cysteine as a source of glutathione peroxidase is a detoxifying agent, enabling the body to get rid of undesirable toxins and pollutants. So, cysteine converts into glutathione, antioxidant. The glutathione in the liver is converted into glutathione peroxidase. It is a detoxifying agent. It will detoxify hundreds of chemicals, toxins, and so on. Diabetics are prone to infections and circulatory problems leading to heart disease, kidney failure, and blindness. Cysteine, as source of glutathione, protects against the complications of diabetes. That is from clinical science. Phosphatidylcholine, that is found in lecithin. In egg, prevents and dissolves gallstone and kidney stones by emulsifying the constituent lipids. So you don't need to be able to eat it if you have stones. I've seen that in many of my patients. Okay? Raw milk. If it is raw milk, it is not heated milk. If the milk is raw, all the antibodies are there. Hep B, H1N1, HIV, everything is there, put there by God. So breast milk is the best for baby. Once the breast milk is heated, it's useless. It does not work anymore. So once the milk is heated, even at pasteurization level, all the antibodies are gone. All the enzymes are gone. The enzymes are the one that empower the heart. I'll talk about that tomorrow. Babalik yata kayo. Bitinig kasi. Dr. Cruz of the Mayo Foundation, Rochester, Minnesota, reported on his raw milk and pasteurized milk treatment as follows. In cases in which there is marked edema, the result obtained are surprisingly marked without the use of diuretics. This is especially striking because so-called dropsy edema has never been treated with large quantities of fluid. So what is he's doing is the reverse. Give them plenty of raw milk and with that. With all medications withdrawn, no more diuretics. One case lost 26 pounds in 6 days. Bigat ba yun? Puro tubig lang yun. Huge edema disappearing from the abdomen and legs with great relief effect. That is for the Mayo Foundation. Dr. Next slide. Cardiac and kidney cases show remarkable improvement. Raw milk and pasteurized. One patient with advanced heart and kidney disease lost 30 pounds of fluid in 6 days drinking raw milk. On the treatment of high blood pressure, Crew reported that he had never seen such rapid and lasting results by any other method. Okay. CLA, you compare the this is superpower and they are found in milk and fats of the ruminant. Yung mga pit belly na natin, okay? CLA reduces renal production of prostaglandin 2, which is inflammatory, without affecting the precursor fatty arachidonic acid. It also has a significant renal anti-inflammatory and anti-fibrotic effect. So the CLA in the milk will prevent inflammation, which will clog the interstitium, and fibrosis or scarring, which will cause obstruction. So, where do you get CLA from? Raw certified. A diet rich in NP-UFA, omega-3 fatty acid from grass-fed ruminants and fish could have a role in maintaining healthy kidney function. In addition to roles of these nutrients in studies blame raw milk for HUS, that is hemolytic uremic syndrome, an infection by enterohemolytic coli. That's why they say don't drink raw milk. I've been drinking raw milk for several years, okay? Including my patients. Now, according to the Pan American Health Organization published in June 3, 2011, the source of the outbreak is under investigation, but contaminated food seems to be the most likely vehicle of infection. There is currently no indication that raw milk or milk is associated with the outbreak. By the way, when we talk about epidemics in gastrointestinal diseases, there are several epidemics related with pasteurized milk, not a single epidemic with unpasteurized milk. I will explain that after. A low carbohydrate diet may prevent end-stage renal failure in type 2 diabetes. So, if you are type 2 diabetes, better be careful. Don't eat too much carbohydrates. Stay away. Eat only whole wheat bread. Better that. Our data suggests that is 2006 nutrition and metabolism. Our data suggests that higher intake of energy-dense, nutrient-poor sources of carbohydrate potentially could impair renal function through acute hyperglycemia. So high carbo, which we call pyramid diet, will actually bring you inside the pyramid. But you're lucky because kasama naman ng table. Diets high in calories, especially alcohol and refined sugar, increases the need for choline. So you see how important is choline. If not even, if you have high carbo intake, you need a lot of choline to remove the fat. The kidney damage becomes more severe. And where do you get choline? Leslie, you get that from egg, you get that from liver, you get that from the brain, and from the bone marrow. All high fat and high cholesterol. A diet high in carbohydrates, carbs, both salt and water in tissues causing dropsy or edema. You'll be amazed. If your diet is high carbo, that will encourage hyperglycemia, hyperinsulinemia. And the insulin effect is too, it has an effect on the aldosterone, and the aldosterone will retain more water as well. So if you have a high carbo diet, you develop more water. Okay? A low carb diet followed for 2 weeks resulted in much improved 24-hour blood glucose profile, insulin sensitivity improved, hemoglobin A1C, and decreased plasma triglyceride and cholesterol level. That is low carb diet. So now it's shifting. It's from pyramid, inverted pyramid. Balik-tali na yun, okay. Kidney stones are associated with high intake of refined carbohydrates. Okay. Ano sa internal medicine 2005? Next slide. Cellular and biochemical medicine, the treatment approach. Concurrently, patients are registered with as part of their food intake. Ito na po yung pagkain nila. Beside the usual food, we give them lecithin granules as source of choline and phosphatidylcholine, brewer's yeast, wild honey, pawpaw, or papaya. Sa abroad, pawpaw daw na sea salt.